Good morning, I'm Dr. Sean. I'm joined one of our patients, and
Good morning.
thank you so much for coming. And today we're going to be doing a hair restoration for her. And this is something that she's been wanting for many years, and we've been going back and forth on it. So thank you so much for coming.
Thank you for having me.
So we're going to be doing an FUE hair restoration, and for her, it's going to be, she has a significant degree of hair loss, so we're going to be focusing on this region and to really just fill it and dense it as much as possible. And we're going to be basically doing an FUE where I individually remove one graft at a time. Awesome. Ready?
Yep.
Let's get started. Perfect. Awesome. Come with me. One of the first things we're going to do, we're going to be working on the hairline. I really truly think that we should just take what you currently have and just dense it up.
Okay.
Right? As opposed to coming, and because there's so much space to do it, right? That and it makes such big sense just to really take what you have and dense it up. I don't think you could, in terms you don't have enough grafts to really create that. At least not with this session.
Do you think PRP will help this part?
No, we just need transplants, right? But see, you have to do priority. Priority is really important, right? It doesn't make sense to have hair here if you don't have anything here. You just have to hit it hard there first.
Okay.
Right? And then let's see how much we can accomplish, right? Today and next session, and let's see how much your hair grows. This is priority. You have to have a good foundation, solid foundation. That's your foundation. If you do anything else, it's not going to look natural, right? But see, if you have very thick hair there, right, it will work a lot with it, and it gives a lot of volume. Perfect. Great, awesome. Okay, now sit up for me, please, and come forward. Now, one of the key things about hairlines is that if you draw a line halfway through your scalp, nothing is symmetric. Look for I'm going to try to make it as round as possible. That maybe, let's see how much we can accomplish with it, but that is the first goal. If you thicken that up, that'd be really good.
How many would that be, like how many?
I think that'd be about 1,700 grafts or so. So let's see how many grafts we could end up getting. I mean, ideally, right, my goal is to just hit that apart and keep going like this. You know, so
Okay.
But we just have to see how much I could dense pack it. Perfect. Do you want to look it up for me just now? Again, the center, oomph. You want to give it a little oomph to the center. Please look right here for me. And please look right over here for me. Great, excellent. It's the end of the day of day 1. We got about 1,400 grafts. The extraction was a bit more challenging than we expected, but we did good. We got 1,400 grafts, and this is the area we covered. So, what do you think?
We're getting my confidence back.
Perfect. In about a few days, we're going to do day 2, where we're going to extract more grafts and place more. So, and the reason we're doing this specifically over a 2-day period, right, is because there was a significant area that we want to accomplish, and so we want to maximize the number of grafts that we get for her in a very short period of time, and that's important. Awesome. Excellent. Good. All done. You have the post-op video?
Yeah.
You do, right?
I follow you on YouTube. I subscribe.
Oh, perfect. So I'll do perfect. Wonderful.
Every 10 minutes and
every 10 minutes. Every 10 minutes. Yes. So if you take a look at it, you see the slight oozing?
Yeah.
I want no oozing.
Yeah, you want it.
I want it very clean. So you come close, spread really well. Make sure it's on the mess mode, right? As long as it's on the mess mode, see, it's just mess.
Yeah.
Don't put it on the shooting mode. This is you don't want, okay? Then you'll be calling me at 2 a.m. Spray. In the next few hours, you take
I don't catch right?
No,
Okay.
you just spray it. You don't touch it. And then in a few hours, you take a picture, you send it to me.
Okay.
You bend at your knee level. Yes.
Messaged you once or like around 11 o'clock, 12 o'clock, midnight.
I know because I'm working on my Instagram. I'm answering all these things that come and people ask questions, and I spend a good an hour and I have a day just answering people's questions on Instagram. So this morning I was answering and then you texted me, oh, you're downstairs. Oh, okay. You know, but please, yes, my personal cell phone is more direct. Spray. Bend at knee level. Sleep at a 45-degree angle with a neck pillow. Eat very good. You have to eat well. Drink lots of food.
We eat good.
Good. Perfect. Okay, that's important. Okay. Instructions in writing, but the video is better. The hats, clean hats, pillowcases. Once you get home, you could remove the clean hat, and just this is temporary. Okay. Perfect. This is A-cells starting tomorrow.
Okay.
You apply 3 times a day. Medicine. The green tablet is antibiotics. It's twice a day, once in the morning, once at night.
So I took one in the morning, so at nighttime?
Yes.
Okay.
This is tramadol for pain. So if the Tylenol does not work, you take one of these. And you work in the pharmacy, so you're very familiar with these, right? Tramadol, right? And you don't take any other medicine, right?
No. I don't.
Okay, perfect. What does this really mean, 1,378 grafts? Well, 191 of them are grafts with 3 hairs, right? 834 are 2 hairs. 353 are 1 hair. So 1,378. So that's actually pretty good. So not a lot. And whatever you had, I took, I think.
Oh.
Right? Because I really searched for them.
Can you connect singles together?
Yes, you could.
Okay.
So on Thursday, if we get the same amount of twos, then but we're probably gonna get less ones on because I need the ones for the hairline. Then we're gonna that one to give you thickness, oomph.
Yeah.
Thickness. So perfect. I'm just gonna have the initial right there, and then you're all good to go. I'm gonna put a hat on for you. By the way, my cell phone is also written there too, right? So you can take this. I did like to see you on Monday. Is that okay?
Can I come after 4?
Yeah, come after 4. Yeah.
I'll text message you.
Yeah. Yeah, 4 o'clock. 4 o'clock is fine. Thursday, we're going to begin at 7 o'clock in the morning. Eat a very good breakfast, like, you know, what I gave you, the pancakes, you know, good carbs, right? And then I'll give you some Valium or Xanax. I have the fan. But you need to be on your stomach for a while.
Okay.
Right? So, just so that I could get the grafts in the middle. Right?
Okay.
I think those are the best quality grafts in the center. Okay. You're all done. Drink lots of fluid. Drink lots of fluid.
And the spray's in here, correct?
It should be. Just 1 second. Maybe it's this. Just make sure it's not alcohol. Perfect.
Thank you so much.
Thank you.